take care of all sorts of patients, children and adults, men and women, rich and poor, and we perform comprehensive ophthalmology. So in about 2006, we moved up here and started the practice from scratch, and the practice took off. We've expanded, gotten larger, both physically as well as the number of patients, and now we have a full-time practice here in Ithaca for over a decade. We take care of folks with cataracts, glaucoma, retinal diseases, folks with neuro-ophthalmology diseases, folks with oculoplastics diseases, that's lid disorders, lots of glaucoma, trauma, diabetes, infection. We do minor procedures in the office, lumps and bumps and biopsies and small repairs of lacerations, for instance, in the eyelid. And then, of course, much of what we do is in the operating room. I spend a lot of time doing cataract surgery, glaucoma surgery, eyelid surgery, and of course, pediatric surgery for crossed eyes or strabismus, tear duct obstructions, and various other things that are less common. We have a lovely office over in the Village Office campus. That's at 2333 North Triphammer Road, right here in Ithaca. I come to the hospital to see consultations as needed, whether it's an adult with an eye problem or a child in the neonatal intensive care unit. I operate at the hospital, I come to the emergency room, but I spend most of my time in my office. We start at about 7:45 in the morning and we finish up somewhere between 4:30 and 5 o'clock Monday through Friday. We have weekend hours on Saturday mornings, many weekends of the month. Well, Ithaca's a small town and we're probably about 50 miles away from the nearest large hospital. So when I came here, I decided I wanted my practice to be as comprehensive as possible. It's difficult to send somebody in the snow who's 80 years old up to Syracuse for a second exam. So in addition to doing the pediatric ophthalmology, which I'm fellowship trained as, I also take care of all sorts of general eye problems. So it's rare that we need to send somebody away. We're comfortable taking care of most things. Of course, we know our limitations, and we happily do send folks to specialists when needed. Patients are sent to us to rule out diabetes or with headaches. We ask other doctors to help us with problems that might be neurological in origin or rheumatological. We don't work on the eye, we work on the patient, so being clinically integrated is so important. The eye is only part of the full person. Being able to speak with neurologists and rheumatologists and endocrinologists about a patient's care is of paramount importance to give them the best care and to help me do that.